This is Dr. Shulian from the NerveMD and the Neurology, Muscular Dystrophy and Neuropathy Institute. In this video, we're going to be describing the different symptoms of CIDP. CIDP generally could affect three types of nerves in the body: the sensory nerves, the motor nerves, or the autonomic nervous system. The sensory nerve are a system of nerves in the body that transmit information from the environment to the brain of what is happening around them. For example, there are sensory nerves in the skin that transmit sensation of hot and cold or pain to the brain, meaning that if a person touches something hot, it is the sensory nerves that inform the brain that the skin is contacting something hot. If the nerves of the sensory nervous system are attacked, then the patients experience sensory symptoms. This could mean tingling, burning, or numbness. If there's tingling and burning, it means that the nerve is malfunctioning and transmitting the wrong kind of information to the brain. If there is numbness, it means that the nerve has become weaker and is not functioning like it was supposed to. And when the skin is touched, then the amount of information that is transmitted to the brain is less. Or if the nerve is severely damaged, then there is no sensation or there is complete numbness. The second system that then the CIDP could attack are the motor nerves. The motor nerves are used by the brain to move the muscles, meaning that when the brain wants to move a muscle, it sends a command through the motor nerves to the muscle for the muscle to contract. The motor nerves are contacting the muscles directly, and they're the most direct control of the muscle that the brain has. If the nerves become damaged in the motor system, then the muscle becomes weak or it stops functioning altogether, paralyzing the muscle. If the nerve is damaged long enough, then the muscle also starts to become smaller or shrink, which is called atrophy. The nerves in the body not only command the muscles to move, but they also have a supportive role for the muscle, meaning that if the nerve is not there, then the muscle shrinks and becomes atrophied. The third system, the autonomic nervous system, could also be attacked, but much less frequently. The autonomic nervous system controls the different organs of the body. It controls the heart, the blood pressure, or the digestive tract. If any of these branches become attacked, then the patient gets symptoms involving those systems, which could be fluctuations in blood pressure, heart rate, or difficulty with digestion. Generally, most neuropathies, including CIDP, start in the feet and progress towards the knees, and then they spread to the hands, meaning that when the patient develops symptoms, they could have numbness, burning, and tingling that develop in the toes, and then it progresses proximally up to the knees, and then it could go to the hands and fingers, and sometimes even higher than that. And when the weakness starts, the same thing occurs. The weakness starts in the feet, meaning that when the patient is walking, the feet don't have much power. The bottom of the foot doesn't rise as much when the patient is walking, and the toes could get stuck on the floor, and the patient could trip and fall over their feet. This is called a drop foot. Also, if the weakness progresses more, and then if it affects the knees, then the knees become weak. And this manifests with difficulty standing up from a chair, or standing up from the floor, or going up the stairs. If it becomes weak enough when the patient is walking, then the knees give out and the patient could fall to the ground. The patient feels like someone has hit him behind the knee, and the knees collapse and they suddenly find themselves on the floor. If the weakness progresses to the hands, then the fingers become weak first, and the patients have difficulty in opening bottles, or they have a difficulty turning a key, or manipulating small objects with their fingers. If it goes further than that, then the shoulders become weak and the patients have difficulty shampooing their hair, shaving, or putting some heavy objects up on a shelf. This is the typical pattern of progression of CIDP. Sometimes we see the reverse. This is less common, meaning that the symptoms could start from the thighs and go downwards, or from the shoulders and down. Usually both sides are involved. We see less commonly that one side of the body becomes involved first, and then it could spread to the other side of the body. These were some of the symptoms of CIDP that were commonly seen. There could be other patterns. And if a patient has these symptoms, then they could have a neuropathy or they could be the specific type of CIDP. Thank you for listening. For more information, please visit our website at nervemd.org.